Have you heard the expression, "I'm as serious as a heart attack"? Well, for some baby boomers, they don't take heart attacks seriously at all. Research suggests that baby boomers don't take cardiovascular disease as seriously as they should. What do they fear even more? Cancer and dementia, according to a recent AP LifeGoesStrong.com survey. Over time, according to the National Institutes of Health figures, at least 1 in 3 Americans will develop cardiovascular disease. The specialists at Florida Hospital Waterman's Heart Center explain the increased dangers of cardiovascular disease as we age.
Pretty much anyone after the age of 40 needs to be into some type of what I would call maintenance program. So they need to see their regular primary care doctor, even if they have no symptoms at all, to start to do what we call risk stratification. And sometimes that can be something as simple as EKGs, routine blood tests, and for certain patients, even if they're asymptomatic, may become somewhat more invasive testing, things like echocardiography, stress testing, and then for the more concerning patients, things like cardiac catheterization. Because like most things in medicine, when we become reactive to the problem, the patients don't do as well as when we become proactive to the problem. So I use the example a lot with my patients, because we all can connect to this, is you're driving your car and all of a sudden the yellow alarm light goes off, but the car seems like it's running fine. You know, most of us, we just punch it, or you hit it, or you ignore it, and you say, well, that's going to go away, that can't be right. But it usually doesn't. But from that moment, you know at some point something bad is going to happen to that car. Might be in 1 mile, might be in 1,000 miles, but the car is doing what it's supposed to be doing. It's giving you a warning sign, and it's saying, hey, there's something wrong, we need to look into it. And our bodies tend to do that as well. You know, we tend to get these unexplainable symptoms, whether it's chest pain or shortness of breath. We tend to do what we usually do, say, well, it can't be heart disease, it can't be this. And the answer might be different when you're 20 versus when you're 50, but the answer is no, no, not never. You know, the answer is the same type of thing. You got to bring it in, you know, you've got to have somebody take a look at it, you know, and to achieve what I call that intellectual honesty. And you can't change the facts. You can't change what your weight is and your age, your blood pressure, at least not at that moment. And you know, that's where I think the greatest opportunity is for helping improve the care of the patients in our community.
Cardiovascular experts note that unless the entire baby boom generation embraces the benefits of moderate exercise and improved diet, nearly 40% of our population will have heart disease by 2030. You'll find more information about the Waterman Heart Center when you click the Heart Disease Boom story link on our homepage at yourhometownhealth.com.